A lot of us suffer from chronic bad breath. But the question is, if we see our dentist, can a dental professional treat chronic bad breath? Might not be something we think of, but you'd be surprised at the answer. To help give us some insight on that, today we have Dr. Pashmini. Welcome.
Thank you.
All right. So whether myself or somebody I know, let's say we have chronic bad breath, is that something that a dentist can treat?
Yes, in most cases. So some reasons are basically systemic diseases. So if somebody's bad breath is because of something systemic diseases going on, then usually we cannot treat it. So the underlying disease has to be addressed first. But majority of the time, most people who have bad breath, it's because of their diet. It's because of oral care. So if the teeth need to be cleaned, if the tongue needs to be cleaned, if they need a deep cleaning, or is specifically their diet that might be causing the bad breath for them. So by coming to us, we can basically test everything, not your chronic illness issues that you might have, but we can see where the bad breath is coming from and make recommendations based on that.
Okay. So what specifically, is it the gums? Is it the tongue? Like if you actually, treat the condition of bad breath, what is it that dentists actually do?
So we start by cleaning your teeth. So there are people who have their teeth cleaned every 6 months or so, and they're still complaining of bad breath. If that's the issue, then we look at the rest of the mouth. Usually the tongue is the main organ that harbors all the bacteria. So when you're eating, all this stuff sticks to your teeth, and we clean the teeth every 6 months, but the tongue is ignored. And usually when patients brush their tongue, they're like, oh yeah, I brush my tongue, but you're only brushing the front half. It's usually the back half that has all the
Mm-hmm.
bacteria stuck to it. And a good test that patients can actually do at home is look at your tongue. Is it covered in a white plaque? Do you have brown speckles on there? Grab a piece of paper towel and rub it on that plaque and literally smell it. You'll see, is this smell coming from my mouth, or is it something systemic going on? So those are actually tests that we do here too when patients come in for a tongue rejuvenation consultation.
So the back half of the tongue could potentially be the cause of bad breath.
Absolutely. Yep. And once we go ahead and clean the tongue and get all of that bacteria removed, usually we recommend maintenance treatment every 3 to 6 months. And we teach the patients home care. So because we can clean your tongue here, but the second you walk out of this office and grab a cup of coffee and drink it, or have a cup of yogurt, it's going to stick to that papilla on the tongue, and it's going to create the bad breath to come back. So just kind of like the way you brush and floss your teeth, you have to clean your tongue to remove all that bacteria on a daily basis. And usually patients are very happy with the results. We cannot cure the bad breath, but we can definitely help minimalize it so that it's not as bothersome to people.
Very informative. I learned something new today. We just go in thinking about cleaning the teeth, but actually we can get some help with our bad breath.
Yeah,
So very
of course.
informative. Appreciate your insight, and thanks for your time, Dr. Pashmini.
Of course. Thank you for having me.
Take care.
You too.